Welcome to our YouTube video on Metformin, all you need to know. Today we will delve into the world of diabetes, specifically focusing on the role of metformin in managing both type 1 and type 2 diabetes. Metformin is a commonly prescribed medication for individuals with diabetes. It belongs to a class of drugs known as biguanides and works by lowering the amount of sugar produced by the liver and increasing the body's response to insulin. This helps control blood sugar levels and improve the body's glucose utilization. Let's start with a surprising fact. Did you know that metformin, a commonly prescribed medication for diabetes, not only helps lower blood sugar levels but also has additional benefits beyond diabetes management? Now let's break it down. People with diabetes face numerous challenges, from constantly monitoring their blood sugar levels to dealing with the risk of complications. Adequate medication is crucial in helping them lead healthier lives. So how does metformin work its magic? This medication helps lower blood sugar levels by reducing the amount of glucose produced by the liver and increasing the body's sensitivity to insulin. This means better control over blood sugar levels and improved overall health. But what about the pros and cons of metformin? On the bright side, it's known to be effective, affordable, and has a long safety record. However, like any medication, it does come with potential side effects, such as gastrointestinal issues. It's essential to weigh the benefits against the risks with the guidance of a healthcare provider. Metformin is vital in managing diabetes by lowering blood sugar levels and improving insulin sensitivity. It's a cornerstone medication in diabetes treatment that has helped countless individuals lead healthier lives. Now let's differentiate between type 1 and type 2 diabetes. Type 1 diabetes is an autoimmune condition where the body's immune system attacks and destroys insulin-producing cells in the pancreas. This results in little to no insulin production, requiring individuals to take insulin injections to survive. On the other hand, type 2 diabetes is a metabolic disorder characterized by insulin resistance, where the body's cells do not respond effectively to insulin. This leads to elevated blood sugar levels. Sometimes the pancreas may not produce enough insulin to compensate for this resistance. Understanding the differences between type 1 and type 2 diabetes is crucial in determining the appropriate treatment approach. While type 1 diabetes requires insulin therapy, type 2 diabetes can often be managed through lifestyle modifications, oral medications, and, in some cases, insulin therapy. This is where metformin plays a significant role. Individuals with diabetes need to understand how metformin works and its importance in their treatment regimen. By effectively managing blood sugar levels, metformin can help reduce the risk of diabetes-related complications such as heart disease, kidney damage, and nerve damage. It is not only about taking medication, but also about making informed decisions about one's health to lead a fulfilling life despite having diabetes. Stay tuned as we explore the benefits, side effects, and best practices for using metformin in diabetes management. Metformin is a widely prescribed medication for individuals with diabetes. It is known for its effectiveness in managing blood sugar levels. It is a first-line treatment for type 2 diabetes and is sometimes used in conjunction with other medications or insulin therapy. Metformin primarily targets the liver, reducing glucose production and decreasing the sugar released into the bloodstream. It also improves the body's sensitivity to insulin, allowing cells to better utilize glucose for energy. While metformin is well tolerated, it is essential to be aware of potential side effects. Common side effects may include gastrointestinal issues such as nausea, diarrhea, and stomach upset. These side effects are usually mild and improve over time as the body adjusts to the medication. In rare cases, more severe side effects, such as lactic acidosis and a buildup of lactic acid in the bloodstream, may occur. It is essential to consult with a healthcare provider if you experience any unusual symptoms while taking metformin. Metformin's potential side effects. Metformin's diabetes management far outweighs the risks for most individuals. In addition to lowering blood sugar levels, metformin positively affects weight management, cardiovascular health, and overall mortality rates in individuals with diabetes. Proper dosage and administration of metformin are essential for its effectiveness and safety. Follow your healthcare provider's instructions regarding dosage, timing, and frequency of administration. In our next segment, we will explore the best practices for using metformin and metformin tips to manage side effects and optimize their benefits in diabetes management. Stay tuned for more valuable insights on this essential medication. Metformin for type 1 diabetes. Metformin, a medication commonly associated with type 2 diabetes treatment, has also been explored for its potential role in managing type 1 diabetes. While insulin therapy remains the cornerstone of treatment for type 1 diabetes, Some healthcare providers may consider adding metformin to a medication regimen for specific individuals. In type 1 diabetes, where the body does not produce insulin, metformin with insulin therapy helps improve insulin sensitivity and reduce insulin requirements. By enhancing the body's response to insulin and decreasing insulin resistance, metformin improves blood sugar control and reduces the risk of hypoglycemia, a common concern for individuals with type 1 diabetes. The potential benefits of using metformin in type 1 diabetes management include improved glycemic control, weight management, and reduced insulin doses. For individuals struggling with weight gain or insulin resistance, adding metformin to a management plan may offer additional benefits in managing their diabetes effectively. It is important to note that while metformin is a suitable adjunct to insulin therapy in type 1 diabetes, it is not an insulin replacement. Insulin remains essential for individuals with type 1 diabetes to survive and effectively manage their blood sugar levels. Metformin should be used under the guidance of a healthcare provider who can assess its appropriateness for everyone's unique needs and circumstances. Common misconceptions about metformin in type 1 diabetes include the belief that it can completely replace insulin therapy, or that it is only beneficial for type 2 diabetes. While metformin has additional benefits in some instances of type 1 diabetes, it is crucial to understand that insulin remains the primary treatment for this condition. In our upcoming segment, we will delve deeper into the considerations and potential outcomes of using metformin in type 1 diabetes management. Stay tuned for more insights on this evolving aspect of diabetes treatment. Metformin for type 2 diabetes. Metformin is a cornerstone in managing type 2 diabetes. It is often prescribed as a first-line treatment due to its proven effectiveness in improving blood sugar control and reducing the risk of diabetes-related complications. As a first-line treatment for type 2 diabetes, metformin plays a significant role in addressing the underlying insulin resistance that characterizes this metabolic disorder. Metformin responds more effectively to insulin by improving insulin sensitivity, allowing for better glucose uptake from the bloodstream. This mechanism helps lower blood sugar levels and contributes to overall metabolic health in individuals with type 2 diabetes. In addition to pharmacological intervention, lifestyle modifications significantly complement metformin therapy for managing type 2 diabetes. Regular physical activity, a balanced diet rich in whole foods, and weight management can synergize with metformin to maintain control and overall health outcomes. Physical exercise in particular enhances insulin sensitivity, making cells more responsive to the effects of insulin and aiding in blood sugar regulation. Moreover, lifestyle factors such as stress management, adequate sleep, and smoking cessation can further support the efficacy of metformin in metformin type 2 diabetes. By adopting a comprehensive approach that combines medication adherence with healthy lifestyle choices, individuals with type 2 diabetes can optimize their treatment outcomes and reduce the long-term complications associated with the condition. In our upcoming segment, we will explore practical tips for incorporating lifestyle modifications alongside metformin therapy to empower individuals in effectively managing type 2 diabetes. Stay tuned for valuable insights on maximizing the benefits of metformin in the metformin management journey. Metformin dosage and side effects. Adhering to the prescribed dosage instructions is paramount for achieving optimal treatment outcomes when managing diabetes with metformin. The care provider will determine the appropriate dosage based on age, weight, kidney function, and overall health status. It is crucial to follow these instructions diligently to ensure the medication's effectiveness and minimize the risk of adverse effects. Common side effects of metformin include gastrointestinal symptoms such as nausea, diarrhea, and stomach upset. To help manage these gastrointestinal issues, taking metformin with metformin or switching to an extended-release formulation may be beneficial. If side effects persist or become bothersome, consulting your healthcare provider is essential to explore potential solutions. While the risk of lactic acidosis is low, it is crucial to be aware of symptoms such as muscle pain, weakness, difficulty breathing, and unusual tiredness and seek immediate medical attention if they occur. Regular monitoring is critical to ensuring the safety and efficacy of metformin therapy. Your healthcare provider may recommend periodic blood tests to assess your kidney function, as metformin affects the kidneys in some individuals. Remember to communicate openly with your healthcare provider about any concerns or experiences you may have while taking metformin during your treatment experience. We value your health and well-being and invite you to engage with us and our community actively. If you find this information valuable, we encourage you to like, share, and subscribe to our channel for more diabetes-related content. By staying connected, You can access valuable insights, tips, and updates to support your journey toward better diabetes management and overall health. Remember, knowledge is power when it comes to managing diabetes, and by staying informed, proactive, and engaged, you can take control of your health and well-being. Thank you for joining us in exploring metformin and its significance in diabetes care. Together, we can empower each other to lead healthier, happier lives.